Lawrence. I'm a public health major at UNCG. This is my disease investigation slideshow about multiple sclerosis. Sclerosis is a chronic progressive degenerative disorder of the nervous system. It is autoimmune in nature, which means autoimmune antibodies attack and damage the myelin sheath, which protects neurons. MS affects 400,000 people in the United States alone. MS typically strikes between the ages of 20 and 40. Women are at greater risk than men. It is the biggest cause of non-traumatic neurological disability. Symptoms include numbness or weakness in a limb, partial or complete loss of vision, and pain during eye movements, prolonged double vision, tingling or pain in parts of your body, Lhermitte's sign, which is a pain in your neck on moving, tremor, lack of coordination or unsteady gait, slurred speech, fatigue, dizziness, and problems with bowel and bladder function. The most common type or course of disease of multiple sclerosis is relapsing remitting MS. This type is defined by periods of new symptoms or relapses that occur over days or weeks. These relapses are followed by periods of disease remission and can last for months or even years. 60 to 70% of relapsing remitting MS eventually develop steady progression of symptoms with or without periods of remission, known as secondary progressive MS. Some MS patients have gradual onset and ever-progressing symptoms without any relapses. This is known as primary progressive MS. The prevalence of MS is not the same worldwide. There's a high prevalence of cases in northern parts of Europe and North America. There's a medium prevalence in southern Europe and the southern United States. Also a medium prevalence in Central and South America, and a very low prevalence in Asia and South America. The national incidence rate in the United States is 10,000 cases a year. Women are at twice the risk of MS as men. The overall incidence rate of MS was 3.6 cases per 100,000 women and 2 per 100,000 in men. MS is also more common among smokers, those with low serum vitamin D, and Epstein-Barr virus exposures. The etiology of MS is idiopathic, which means they really don't know. There are some known risk factors, though. Being of Caucasian race, having a family history of MS, and certain HLA types. Also, environmental factors, living in northern climates, exposure to Epstein-Barr and other viruses. The strongest known genetic factor is the HLA type DRB1-1501, but this only increases risk 2 to 4-fold. It is also found in 20 to 30% of healthy individuals who do not have MS. There is a strong familial link, 20 to 40-fold increase risk of MS in first-degree relatives of patients with MS. There's a 25 to 30% concordance in monozygotic twins compared with only 5% in dizygotic twins. MS is disabling. It disables its sufferers by affecting neurological function, cognition, and emotions. Patients often report feeling crippling pain and fatigue. They also have higher rates of depression and suicide than the general population. Some things that predispose people to worse outcomes when they have MS is older age. The statistics on sex correlations are not conclusive, meaning they don't know whether men or women fare worse when it comes to MS prognosis. Primary progressive MS patients do often face greater disability, but early diagnosis and treatment can improve long-term prognosis. To diagnose MS can be difficult Doctors often use a differential diagnosis, which means excluding things until they've come to the conclusion that you have MS. This is done by using a neurological exam, a thorough investigation of medical and family history, an MRI of the brain and spinal cord, evoked potentials, and a lumbar puncture or spinal tap, which the cerebrospinal fluid is examined. To manage MS, there are two goals of primary treatments: immunomodulatory therapy for the underlying immune disorder, and therapies to relieve or modify symptoms, because there is no cure. And when patients present with acute symptoms, physicians often use corticosteroids or plasmapheresis, where corticosteroids are not indicated. Some patients seek therapy outside of Western medicine and use things like acupuncture, yoga, meditation, or special diets. A lot of people are also using medical marijuana to treat MS symptoms, although this is very controversial. According to the American Academy of Neurology, they recommend the use of oral cannabis extracts for muscle spasticity and pain, but do not recommend cannabis in any other form for MS symptoms due to a lack of evidence. Marijuana is technically illegal at a federal level, but many states allow for medical use. There is no way to prevent MS, but there are people who are trying to improve outcomes and reduce the risk. Preliminary studies show that high serum vitamin D levels correlate with a low risk of multiple sclerosis. So some people are suggesting supplementing MS patients or those at high risk with high doses of vitamin C. Also, early treatment with immunomodulatory drugs is associated with a decreased disability progression and lower secondary relapse rates. No true prevention is currently possible. The World Health Organization is doing research in MS. Key areas of current research encompass immunology, genetics, virology, bacteriology, and the biology of the cells that make, maintain, and repair myelin in the CNS, including developments in neural stem cells. The key outcome of the research effort to date has been to improve understanding of the pathology and the evolution of the disease and, as a consequence, new approaches to treatment, including repair and neuroprotection. Locally, Raleigh Neurology Associates and Duke University recently recruited 1,000 people with multiple sclerosis, including 100 people with primary progressive multiple sclerosis. Long-term research projects are happening at North Carolina Research Campus in Kannapolis. They are looking for genetic links and hoping to get a better understanding of MS and the disease process. The Healthy People 2020 goals do not have a specific goal for multiple sclerosis, but after looking through their site, I found the most applicable goal to people suffering with multiple sclerosis is the goal to improve disability and health. The statement from the website says that their plan is to maximize health, prevent chronic disease, improve social and environmental living conditions, and promote full community participation, choice, health equity, and all quality of life among individuals with disabilities of all ages.